Thank you very much. Thanks, Dr. Benjamin, for the invitation to come. And Celinda, thank you for those great insights, as you always have. So why having the governor of Michigan come to Chicago when I'm not an expert in healthcare, other than it was under my portfolio as governor of Michigan? And the reason why I have been asked to come and speak to you is because I want to give you the perspective of a politician, the people who you're trying to persuade, at least not the citizens, as Celinda was trying to describe, but persuading the folks who you hire. So I love public policy, and in my preparation for coming here today, I wanted to find out something that you already know, which are the answers to these two questions. First of all, what is the difference, because all of this bloviating that's happening about Medicare, what is the difference between the public health care system and the costs associated with Medicare and private health care? I wanted to know the answer to that in terms of price. And second, what is really the difference between the United States' health care system and that of other countries? Now, you probably know the answers to this, of course, but if you took a 65-year-old today and insured them under Medicare, and took that same 65-year-old today and insured them under the private health care system, of course, Medicare is going to be less expensive, right? Under the private health care system today, it's about a 12% difference. And I went to the Congressional Budget Office for these numbers because you have to have objective data. And so I said to myself, well, let me see what happens if you extrapolate it out a decade or so. So 2011, it's a 12% gap. If you took that forward, the difference between private and public for that 65-year-old to 2022, it's a 39% gap. So the public health care system, as it is 39% cheaper than the private health care system. Now, I was doing all this in the wake of all of this discussion about Paul Ryan's proposal and privatization and all of that. 39%! Holy moly! So my second question, so what is the percentage? What's the real difference, or the actual difference, between the cost of healthcare in the U.S. and the cost of healthcare in the other advanced countries? And so today, the cost of healthcare in the U.S., and this is public and private, for those who are insured, you guys know what it is? About $7,500. $7,500, you know, everybody in, and not everybody, all who are in, $7,500 for health care on average in the U.S. You know what it is in other advanced countries? $3,060. Less than half. Oh my gosh. So, and this is, I was like, wow, you all knew this, right? No, nothing for you. But, you know, for me, the politician, the person that you're, you know, I'm a former politician, but the person that you would be trying to convince, that's a huge number. $7,500, $3,000. That's significant. So I said to myself, okay, so those countries must therefore, even though it's cheaper per person, they must be spending a greater percentage of their overall economy on health care, right? Because they're covering everybody. The other advanced countries have some form of universal health care coverage, so they must be spending a greater percentage of their economy, their GDP, on health care. So I said, to be fair, let me go to the next most expensive country. You know what that country is? It's not Canada, it's Norway. Norway's the next most. So the U.S. average is $7,500. Norway spends about $5,000 per person, so still $2,500 less. And so I said, well, they've got to be spending a really big portion of their GDP on health care. The U.S. spends 16% of our GDP, of our economy, on health care. And I figured Norway must be spending, what, 20, 25%? Norway spends 8% of their economy on health care. And so I'm scratching my head thinking, what the heck is going on? So not only is the public health care system in the United States cheaper, and of course we aren't covering everybody, and our healthcare is half of, others' healthcare is half of what ours is. So I said to myself, okay, well, given all of this, obviously, we have some fantastic healthcare outcomes, right? So I look, now I know I'm telling you all stuff you already know, but we are last of 19 countries in mortality rates? Come on. And then, of course, we're the most obese country on the planet. Kathleen Sebelius, what did she say? She said that our health outcomes were worse than developing nations. Okay, so all of this money we're spending doesn't provide us with access or quality. Isn't this something that we should be fixing? You know what I'm saying? It's so weird because this is an example of a U.S. policy that has resulted in almost absurd outcomes. If you asked any business person, you give them a graph of the data. You know what they say, in God we trust, all others bring data, right? So you give them a graph of that data with the U.S. as an outlier in all the negative senses on the key factors, they would say, fire the person in charge of that system, right? Wouldn't they? So why then, I wondered, is fixing this thing so darn hard? And I know, if it were me, of course, it would be a different scenario. But if I was our, but what we used to always do, like you all do, is that you look at best practices, right? So what would be so unusual for us in this system that seems to be so weird, for us to be looking at the best practices of other countries, of other entities? What are they doing right that we're not doing right? And I would be asking of Congress, so in this era of budget deficits, when other countries are spending half of the amount per person that we're spending, wow, wouldn't this be an opportunity to save an awful lot of money and cover a heck of a lot more people if we had the right practices? And I would ask you, why is it that we aren't fixing this problem? And my guess is you would say to me back, well, clearly we're not fixing this problem because there's all sorts of vested interests in the problem, right? The insurance companies and all of those who are profiting by the current status quo. So I would say to you, I think that is a really important reason, but I think there is another reason going on here. And this is just me knowing what's out there in the political realm. The reason it's become so illogical is that if we actually did start borrowing ideas, best practices from elsewhere, God forbid, it might mean more government. It might mean more public sector involvement. Honestly, we are so afraid of government and of government involvement that we are willing to tolerate illogical results. So this hatred of government, or the wanting to drown government in a bathtub and all of that craziness, is uniquely American. It is. E.J. Dionne, one of my favorite columnists, wrote a column about this a couple of weeks ago, and he said he observes that while the policymakers in Washington are fighting about the deficit and speechifying about all the things that government should not be involved in, other countries are actively engaging in policy and public-private partnerships and trying to do what they can to serve their citizens. If you look at other countries, they don't have this weird aversion to government helping citizens. They're willing to allow their governments to make their citizens' lives better. America isn't even sure we should have gone halfway toward ensuring people with the Affordable Care Act. And other democracies, advanced countries, long ago, insured all their people for half the cost. here's another example, sort of in a different realm, one that's close to my heart, because I really have been focused a lot on creating clean energy jobs. Other countries have leapt over the United States in involving themselves in the economy to create jobs for their people. And in the United States, it is almost apostasy for some on the right to say that they believe in the science of global climate change. It's considered heretical, unpatriotic to ignore. You have to believe in the scientists is somehow wrong. I just don't get it. Now, let me just say that I would be the first to say, of course, we have to have fiscal discipline. We know that we've got to balance the budgets. Every state's got to do that. You know, I had the privilege of serving as governor of Michigan during a time when Michigan's economy was in free fall. We had, as a state, 7 times more automotive employment than other states, and so we were hit 7 times harder when the manufacturing sector began to be sucked to low-wage countries in America. We just got slammed. So as a consequence, the revenues to the state of Michigan declined a lot, and so I had to cut and cut and cut, and as a percentage, I cut more out of state government than any state in the nation over the past decade, and that was painful. By the time we left office, Michigan was 48th in the country in terms of the size of government per capita. But I never cut anybody off of health care. Not one population in Medicaid or anything like that. But I use that as an example because all of the rhetoric about how if you have a smaller government means you're going to facilitate job creation and businesses will flock to you is just not accurate. Michigan is one of the laboratories of democracy, and in my laboratory, and I cut taxes in my first term thinking that it was desperate to create jobs, that was going to do something. We still had the highest unemployment rate for the last decade. And it's because our economy is no longer just competing. We're not just competing with Illinois or Indiana. We're competing with China and Mexico, and those other countries are actively engaged in pulling employment from America's shores. So my point on this is that it was only when the federal government decided that they were going to intervene and get active that Michigan started to uptick again. And believe it or not, it was the Obama administration's decision to save the auto industry and intervene in the market to do that, and to provide, because of the Recovery Act, grants for clean energy job creators to come to America, that in 2010, Michigan's economy had the fastest job creation in the nation. And I say that only because it would not have happened except for government involvement. So, my point on this is saying that not all government involvement is a bad thing. Healthcare is a competitiveness issue. Several years ago, Ontario began making more automobiles than Michigan for the first time ever. And those automakers were not going to Canada because of the tax rates. They weren't going to Canada because they're small government and no regulation. They were going to Canada because of health care. And we in America have decided to put the burden of health care on the private sector, whereas other countries share that burden. It's a competitiveness issue as well. I think the people that are the most amazed about our country's inability to get in the game of creating jobs and being economically competitive are the CEOs that actually are doing business in a number of different countries. I sit on the board of Dow Chemical Company, and Andrew Liveris, who's the CEO, wrote a book called Make It in America. And in this book, he expresses amazement that the United States is acting as though nothing has changed, as though globalization has not entered into the fray. And he says that countries are acting more and more like companies, that they are competing aggressively against one another for business and progress and wealth. And meanwhile, in the United States, we operate as though nothing has changed. Passivity, though, is not anymore an economic strategy. bystanding, laissez-faire, hands-off is not an effective economic strategy in the 21st century global economy. So this brings me to the point about you guys and why you should care about those who hate government and its size. I think that this hatred of government it's just really kind of a curious form of self-loathing. Don't you think? I mean, really, what is government? It's us, right? This fantastic system of democracy that we venerate, that we encourage other countries to adopt, like the Arab Spring, that we send our young men and women to go and fight for. And yet, we hate the product of democracy, which is government. I say we, of course, my assumption is that there are many in this room who are not in that we. I want to read to you a quote because this singular oddness of loving democracy and hating government or fearing government is part of what has been the ethos of some on the far right, including the birth of the Tea Party movement. Here's a website, a Tea Party website. This is a website, this is a couple of sentences from a website that venerates Jeffersonian democracy but hates government. And it says this is a quote: "Government is not love, it is evil. Government corrupts and abuses everything it touches, wastes the wealth of its citizens, debases the people's currency, sponsors inequality, and persecutes people for crimes a mere pittance to its own." Come on. I mean, that is really disturbing. And that voice, that kind of voice that hates government involvement is getting louder and louder and louder. I mean, the bizarre thing is really, if you don't like what they're doing, throw the bums out. I mean, it's the greatest form of DIY governance around, right? Do-it-yourself leadership is all about you all having a say. I just don't understand the mentality of it. So I would love for us to do some therapy on the self-loathers. I think that in therapy, sometimes you have to stage an intervention to confront a deluded person with the truth, right? So you all, many of you have been very active, and the public health community is known for its activism. So I want us to stage a big intervention on America. I'm not asking you to do the whole thing, but you obviously are a key respected voice if our therapy is to produce the desired healthy outcomes. So many of you are doctors and nurses and researchers. You all have letters after your names, and maybe you're not a scientist, but you know how lab experiments work, and you introduce a new element into the experiment, and you get a different outcome. You add some more chemical into this test tube, and the chemistry reacts differently. So I'm a scientist too. I'm a political scientist. I know that doesn't count for many of you, but in my lab of democracy, I can tell you that a heavy dose of citizen activism, if introduced in the right way in the experiment, will cause the outcome to be much different than if citizens are passive. And so, for example, I can tell you, based upon empirical data, that if the experiment calls for a balanced budget and there's very little money around and a politician has several options, he or she will take the path of least resistance. And I know the path of least resistance is part of what you learned in physics, probably. It is engineering science, but it's also human behavior. If there is a great amount of resistance, then the outcome will be different on that experimentee, the politician. So let's assume we've got two goals in our lab. Let's assume that the first is to maintain at least the reforms in the Affordable Care Act and allow it to proceed rather than seeing someone else come and undo those reforms or see them be taken away. And the second goal is to prevent these damaging cuts to the prevention community or to transform Medicare into a private, to privatize Medicare. So let's assume those are our goals. And by the way, not saying that you can't improve the delivery system. The delivery systems on everything, including in the private sector, can be improved, and we all know that. But if we agree on these goals, from my experience in the laboratory, here's what I would recommend as interventions. There are three. First is volume, second is personal contact, and third is surprise. And now when I say volume, it has to be done in the right way. Lots of people making lots of noise is powerful. Lots of people making lots of noise on the office in front of the office of a member of Congress, that's even more powerful. Lots of people making lots of noise by sending form letters doesn't work. People making lots of noise by writing letters to the editor when you're not calling someone out by name doesn't work. If you write a letter to the editor, name names. I can just tell you, if people are mad at Congress, pox on all their houses, it not only doesn't do anything, but it allows those who oppose you to hide, and everybody gets under the same umbrella. Name names. If you are a nurse, put your letters after your name in the letter to the editor, because there's nothing that a politician wants to see, nothing worse than seeing their name in the paper by somebody who's a respected member of the community calling them out. When you send letters to individual offices, don't send form letters, send individual letters. Every political figure has a calculus about how many people one letter represents. In my case, 25 citizens, one letter. So it's important that you intervene and that the volume is loud. Personal contact, obviously, you know that if you know somebody, you know a member of Congress, that's really, really the best way. If they have office hours, go. Personal contact is critical. Town hall meetings, a little bit more attenuated, but you need to be in front of someone so that they can explain where they are. I can't tell you how, I used to have office hours every month. The third Thursday of the month, everybody got 5 minutes to come in. Policy was made because I had contact with individual citizens. The third way I would suggest is truly surprise, something unique, something that catches media attention. If you, for example, in Michigan, the Tea Party, or a precursor to the Tea Party, was opposing some revenue enhancement that I was looking at to do, and they, in the middle of winter, put 100 snowmen on the lawn of the Capitol holding signs opposing the effort. And the media loved it. They were all over it. So if you can be creative and call someone out by name, that's really important. Now, lest you think that your time is best spent in your office, and there may be some of you here who think that, or maybe some of your colleagues who aren't here at this, APHA, I would suggest that you pull them back to earth and remind them of why they went into public health to begin with. Yes, they're supposed to be doing their job and serving, but truly, a part of that duty is to change the world, right? And so you have a duty to be heard, and this is why you're such an effective messenger. The health community is about the whole public. I so love this in doing the research for this. I watched a young woman give a graduation speech about public health. She was graduating from public health, and you guys may have seen this before. But she talked about the nobility of public health. It just gave me goosebumps. And she said, I don't have her exact words, but she's basically said that probably somebody in public health got this crazy notion that it was more important for us to be about the whole than about the individual, that we are better and nobler when we are about the whole. And you referred to this, Dr. Benjamin, this morning, or this afternoon as you were introducing folks, that we pool all of our money for some things, right? We decide that it's best to ensure that the professionals do the inspections of the meat rather than somebody else, or allowing kids to come down with E. coli. We decided that maybe we should band together to pool our resources so that kids can get inoculations rather than allowing kids to die from communicable diseases. We decided it's best to pool our resources to teach kids in public schools rather than letting each family fend for themselves. I mean, could you imagine what it would be like, truly, if you didn't have that sense of community? So on Tuesday, Dr. Murray, maybe it's your turn to, teach the kids in kindergarten, and Dr. Benjamin, maybe you patrol the community. You get your gun, you patrol the community on Fridays, but hang on to your gun because on Saturdays you are scheduled to be in the prison. Celinda, you're going to pave Lakeshore Drive on Saturday or Monday, wear your hard hat. Governor Quinn's going to start inoculating the seniors for the flu shots. I'm sure it'll all work out well, but that's why we band together. It's the common good. You put the public back into public health, and I love the fact that public health is not about biology necessarily. It's not only about health care. It is a form of social justice. It's about political and economic justice. It's you're radicals. It's great. You recognize that someone's status, like being a woman or somebody who's poor or a minority or somebody who was afflicted with AIDS, that is an issue of inequality and social justice, with biology as the effect and not the cause. So I think as you stage your intervention, reminding people about the public part of that mission is critical, that we're all in this together. And Celinda had some messaging related to that. And we're all in the same boat is the way many people refer to it. And yeah, it's a little bit tight, this boat. And yeah, we're going to sail in a cramped way to the promised land of affordable health care. But what we've decided is that we are not going to throw out the grandma because she can't row. And we're not going to put the kids on the shore because they're too small to row. The strong ones are going to row, and we're not going to say to somebody who's got a disability that you can't be on board, or somebody who's poor because they can't afford the passage. That we have decided that we are a better boat if we are all sailing together. And it may not be a race about who gets there fastest, but the one who wins the race is the one who arrives with the whole family intact. And to me, that's what determines greatness. That is what determines greatness. So I am here to exhort you to help make this country great by staging an intervention in this experiment called democracy. So by the power vested in me, I have no power because I'm the former governor, but work with me on this. You are all called, you are all enlisted to get in the faces of your employees, the politicians, the people you hired. If they work for you, and they do, they should be doing what you want them to do. They need to know what you want from them, and you need to be really clear with them about your instructions. They need to hear you, and they need to fear you. So, in the philanthropic world, they say that there are two kinds of people. Some of you may have heard this if you're involved with philanthropy at all. There are the finders, and there are the founders of the world. The finders of the world and the founders of the world. And the finders are the ones who stumble upon the world and who say, oh, that's nice, and maybe they cross the street because of the messiness of it. And the founders of the world are the ones who happen upon the world and act. And they are the movers and the shakers and the doers and the instruments of change. They build this world. And, you know, I think you should tell your colleagues, those who weren't fortunate enough to be at the APHA, that they are founders. For what the heck did they go into public health for if they weren't instructed and moved to found the world? Because in the end, when you die and you meet your maker, you're going to be asked two questions. You'll be asked, what did you do with the talents you were given? And when your brothers and sisters needed help, what help did you offer? And something tells me that you radicals, you public health aficionados, you activists, you are all founders of the world, and I exhort you to go out and stage an intervention to make the world a better place. Thank you so much. All right, Dr. Benjamin says we can do 2 questions. They have to be really good. No pressure. No, any questions? Gurgle, gurgle, gurgle. Stomachs are grumbling. Yes, sir.
Hi, thank you so much. Now I know why Janet Olszewski love working for you.
Are you from Michigan?
No, I'm from ASTO. I worked with Janet.
You're from Massachusetts? Which?
ASTO, the Organization for the Health Officials.
ASCO, all right, very good.
Your chief of staff once called and scolded me for something I did. So.
Janet Olszewski was the best.
My question is this, right now in the House where the budget's originating, people may not be able to hear the way we talk and our feelings. So how do we learn how to talk in the currency that members in the House or the appropriators can hear? Because we have to talk differently than we talk to each other.
You do, and differently than you talk to the public, as Celinda's language. They're obsessed with budgets. I think that's why I started out with these stats that I think would have impact. I mean, if we, obviously keeping the Affordable Care Act intact, but stats, data related to, for example, prevention, clear data, and often prevention is hard to have hard data on because you're establishing what would have happened if you hadn't intervened, right? But if you can establish that something saves money, that they can actually count, and you could convince the Congressional Budget Office about it, that's the language that everybody's speaking. And you have a good case to make. So it's all about dollars and cents when you're talking to the politicians.
Good afternoon. I would just like to, I guess, make a comment to Jillian's question and really talk about some of the programs that have worked. I'm from Minnesota, and I went there from South Dakota being the chronic disease epidemiologist. And now I am a public health evaluator and mostly evaluate some of the SHIP, the Statewide Health Improvement Plan, counties that were funded. And the state right now, the governor, Mark Dayton, is 100% for SHIP funding. And with the looming deadline of June 30th, the government is set to shut down in Minnesota. Local counties there have been doing a lot of programs for policy, systems, and environmental change at various levels, and they've all been really engaged. And my task has been to help them in creating innovative, new programs that the reach goes to everybody throughout the state, regardless of age, economics, things like that. So for reference, I would encourage you all to go to the Minnesota Department of Health's website related to the SHIP initiative. And I'm not from the Department of Health. I work at the Institute of Public Health, which is 501c3 that does evaluation and planning. So I would just really like to encourage you to use that as a resource. Coming from South Dakota, I've really been able to see how much you can really engage people and get people on board through this SHIP program. So that was just my comment. Thank you.
Great, what she said.
Hi, I loved your presentation. It was great. My name is Tony Sullivan, and right now I'm from Orange County, California. I'm a retired person from the field of nursing education, administration, and public health. And now I spend all my time with those politicians that you're talking about reaching. And I am very active in the Democratic Party in Orange County. I'm an officer and a member of their executive board. Anyhow, what I want to know is, can we actually access your presentation? We have this little gizmo where we can plug into our computer. Is your presentation going to be on and available to us? I sure as hell wish it would be. I want to show it to all my colleagues.
All right, they said they would make it available, so there you go.
The video?
Yeah. So thank you all very much. I hope you do go forth and change the world. Thank you.